Hey guys, Dr. Kyle Loveless here. Today I want to talk to you about SI joint or sacroiliac joint pain. This is something that's extremely common. You probably have even felt it before in your life, but it's ultimately pain in your lower back area that's right in those joints where your pelvis meets. So specifically, if you look at the spine, this is the lower back. These are the two pelvic bones, or the iliums. Right here is the joint where your sacrum and your iliums meet, okay? They call that the SI joint, sacroiliac joint. And ultimately this area should have about 1 to 3 degrees of motion when you walk. That motion allows you to walk properly and everything else. Many times, one of two things can happen. These joints can actually get locked up where they don't move properly, which is called a subluxation. That's what we work on when we adjust. Or two, they can actually become too loose. So you can actually get ligament laxity in the ligaments that surround this part of your sacrum and your iliac, or your ilium. So the thing that's really important about this is knowing which one it is, right? So if you're someone that's dealing on a regular basis with sacroiliac pain and those SI joints, knowing that number one, it's figuring out what's causing yours, right? Because it might be that, it might be a subluxation where your spine's not moving or your joint's not moving, or it might actually be the opposite. And they're two different protocols in terms of which one they are. The other two things that it could be is referral pain from an organ. So for women, ovarian cysts or other ovarian issues can actually refer pain right into that SI joint. So it's also looking at that area as well. And then the final one, a lot of times for guys, the kidneys, the urethra goes right down here, right? The tubes that come all the way to the urethra right here, they can actually get, if you get any calcium buildup or any stones in there, it can actually refer pain to that SI joint too. So there's a few things that can be. Regardless of what it is, the first step is finding out what's actually causing it. The way you figure out what's causing yours is you can investigate. You can start to think, okay, what causes my pain? If you're someone that maybe you stepped off some stairs, or first, here, let's do it this way. The first thing I'm going to talk about is when it subluxates or when it locks up and that joint's not moving. That typically happens from if you're doing a lot of stress in that area over time, maybe a lot of sitting, a physical stress on the body, maybe it was a car accident, maybe it was something like working out strenuously over that area. Those joints can actually lock up, okay? So the first thing we do is think about what caused it. When it comes to ligament laxity, when the ligaments in your SI joint are actually too loose, this one's really big. I have a lot of patients, actually just had a patient today who they've gone through chiropractic care in the past, they've done physical therapy, they've tried all these different ways to get rid of their SI joint pain, all just to get a little bit of results, meaning they would feel better, but it always would just keep coming back. When someone tells me that their SI joints have been hurting, it feels better with some care, but it just keeps coming back, that makes me think that it's not locked up, because that's what the adjustment does. It gets rid of the locked up joint, that it actually is loose. It's too loose. Many times cheerleaders, dancers, people, gymnastics, gymnasts, people that need a lot of laxity throughout their body, right, are gonna have many times loose SI joints, okay? One of the things you can do, a test on your own you can do also to see if you have lax ligaments in general, right? This is more common with women because of estrogen. It helps laxity of the ligaments, and many times during pregnancy it'll get even more loose. But ultimately, when you take your thumb, right, you can see my thumb, I can't get it any farther than this. So mine aren't very lax, right? Mine are kind of average, I guess you could say. If you can get your thumb all the way to here with simplicity, that tells you that you have loose ligaments. If you're someone that has loose ligaments like that, you're more prone to things like ACL tears, things like ankle sprains, also SI joint issues. This is big. If you're someone that you had a baby, maybe you were pregnant, you had a baby, and afterwards you continued to have that SI joint pain, many times it's because hormonally those ligaments didn't tighten back up and they're still loose. And so this is really important to know if it's a SI joint issue from ligament laxity, because the protocol for it is going to be completely different. If someone comes in and they're subluxated in that SI joint, it's not moving, we're going to adjust it. We're going to put them on their side, we're going to get that moving, and it's going to be great. They're going to see amazing results. But if you're someone that you have SI joint laxity and we adjust on the side like that, it might feel a little bit better. It might even hurt when we do it, but it's going to continue to be back and forth. So we want to actually strengthen up that area, solidify and support that area, not just get it moving because it's already moving too much. Hopefully that makes sense. So when we look at this SI joint, just as a reminder, that's right here what I'm talking about. This part, when you have pain right in that area, if it gets inflamed enough, it can hit the sciatic nerve, it can go all the way down your legs, but right in that SI joint, okay? So when we talk about ligament laxity, we have to not necessarily adjust more. We need to retrain the body or strengthen up this part of your body to support those loose ligaments, okay? The final two, I'm not gonna spend a ton of time on, but if you're someone, maybe you have ovarian cysts or issues and that's referring pain there, then we need to work on estrogen levels and hormones and see what for you needs to be done, meaning test. We need to do a Dutch hormone test. We need to do a female hormone panel to see what is actually causing the hormone issues that led to it in the first place. So that's a individualized thing. For men, if you're having kidney stones, if you have a history of kidney stones, then we need to work on maybe giving you some potassium chloride or something that can help break up some of those kidneys, and also looking at your diet, okay? So let's talk about that SI joint laxity, where these ligaments right here are super loose, okay? Instead of laying you on your side, right? Laying your side and boom, adjusting like that, we're gonna do different adjustments, okay? The adjustments that we're gonna do, or if you go to a chiropractor, they should be doing for this, is drop adjustments where the table, okay? So our tables actually go up and down. They have certain areas that will drop. And when you're laying on your pelvis, we'll actually do light drops to help just make sure everything in there is moving properly and pulling things into the right direction. The second is to use an activator. So I have one right here, okay? So we have this right here, and this is a tool that clicks, right? And it helps put that motion into the joint and also helps stimulate that joint. And then the final thing is we use wedges. So we have something called sacroiliac wedges that you lay on, okay, SI blocks, and you lay on, and they actually will help line your pelvis up and actually help push them together. If you're someone with sacroiliac ligament laxity, this is something that feels amazing to you because it literally like helps pull everything tight. Another way you can tell, actually, I just thought of this, when you put on really tight pants or really tight clothing, if that feels good and helps some of the pain, that's a good sign that your ligaments are too loose, okay? So first, we change the way we adjust. We don't do high velocity, full movement into the joint. We're doing simple, light stuff and things that help solidify that joint more than, and put it into alignment more than getting a lot of motion into it. The second thing we want to do is release some of the muscles around there. So if let's say your right SI joint's hurting, well, your left SI joint, or left side, typically going to lock up on you. You're going to get muscle tension, you're going to get trigger points in there, and so we want to go and release those trigger points with certain muscle tools that we use, but also with our hands, we can help release some of those joints. Another thing you can do on your own is actually get a tennis ball, or I'm sorry, like a lacrosse ball or even a golf ball, and you go in, you'll find when you push in your pelvic area and you go slowly through, you'll find those tender spots where the trigger points are at. Those are called trigger points. Lactic acid will build up in there. And you can go either with your thumb or you can roll on a tennis ball right around near those joints. I'm sorry, a golf ball or a lacrosse ball, and you can roll right on those joints and hold it on there until it releases. And that release will help some of the muscular aspects of it as well. So it's a little bit of chiropractic, a little bit of the physical therapy aspect of it. And then the other part is stretching the muscles that surround the pelvis. If you have very tight hip flexors, that's gonna rock your pelvis, okay? So if your hip flexors, which are the muscles that come from here to here, right into the pelvis, right? Go down to the legs, and they cause the pelvis, when they get really tight, this is from a lot of sitting, a lot of sports, your pelvis will actually rock, okay? And that can jam up these joints, but it also will cause your pelvis to have more pressure in those SI joints. So by stretching, doing hip flexor stretches, okay? You can look up, if you go on YouTube or go to some of our other videos on home exercises, look at the hip flexor stretches, the ones that release your psoas muscle, okay? And look those up and start stretching those on a daily basis. And then also your piriformis muscle back here, that figure 4 stretch, okay? Those muscles really tighten up whenever your SI joints are loose. So getting into that figure 4 position, I don't know if you can see it, but it's cool. I think you might know what I'm saying, but look on YouTube and do figure 4 stretch or piriformis stretch. And you're gonna start to stretch those piriformis muscles and your hip flexors. And then the next thing I'm gonna recommend doing, there are some actual supplements you can do to help this healing process. So one of the supplements I'd like to recommend is turmeric. Turmeric's amazing for your overall health. It's amazing for your DNA replication, all those things. It's also really effective at keeping inflammation down, helping your immune response at that same time. And this creates inflammation in those SI joints, which can cause pain. The second is collagen, right? We're looking to strengthen and build up tissue. So using collagen is really good for helping those ligaments and really the whole aspect of your joints. So the final thing I'll recommend is getting something called a trochanteric belt. Okay, that belt is something that it's very simple, just wraps around your pelvis. It's like a belt, right? Like a normal belt, but it's about 3-4 inches thick, right? And you wrap that around your pelvis and you'll feel it. It goes right around the hips and it tightens up that area and helps support those ligaments. It's not like most back braces. Most time you wear a back brace, like the corset brace, it will actually weaken your muscles and make you worse in the long run if you wear it all the time. This trochanteric belt actually will help support, not weaken the muscles, not do things for you, but it supports your pelvis from being so loose. And when you put that thing on, if you have ligament laxity, you're gonna feel the difference. That same patient, when we put that trochanteric belt on, it's just like, release, right? So you can wear one of those as well. And usually that's like a 2 to 4 week process that you need to be wearing that on a regular basis to help kind of get everything strengthened back up. Okay, so those are the main things that we recommend when you have ligament laxity. It's not more motion, it's not more exercise, it's actually less of all that and helping to strengthen everything back up. Okay, so making sure you're figuring out, is it a subluxation where you really just need adjusted and we got to work on releasing some trigger points, or is it ligament laxity where we have to actually go in and help restore those ligaments and restore that area rather than just putting motion back into it. That's a big one. So if you're someone, maybe you've done chiropractic care, maybe you've done physical therapy, and it just hasn't gotten that release, it just keeps coming back, that's what you want to try. Cool. And if you want to try a different chiropractic, like the stuff I just talked about, just go to queencityhealthcenter.com. We're here in the Charlotte area. If you're listening to this video, you're not in Charlotte, just say, hey, I want you to help me find a chiropractor that will do that kind of stuff. And I'm happy to connect you with those doctors all over the country as well. Okay. All right. You guys have an awesome day, and we'll talk to you next time.
Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.